What causes emotional dysregulation? Have you ever felt overwhelmed by your emotions, especially in stressful situations? You are not alone. Emotional dysregulation can happen to anyone, and understanding its causes can help us manage our feelings better. Let's break it down. Emotional dysregulation occurs when someone struggles to manage and respond to their emotions in a typical way. This can lead to intense emotional reactions and impulsive behaviors. Several factors contribute to this issue, particularly when it comes to survival skills and decision-making under pressure. First, biological and neurological factors play a role. Some people may have a natural tendency toward emotional dysregulation due to differences in brain structure. The prefrontal cortex and amygdala are key areas involved in regulating emotions. If these areas do not communicate well, it can lead to stronger emotional responses and less control over those feelings. Additionally, imbalances in brain chemicals can affect mood stability and how we handle stress. Next, trauma and stress exposure are significant contributors. Experiencing trauma, especially during childhood, can disrupt the development of healthy emotional regulation skills. This can make a person more sensitive to stress and harder to calm down after emotional triggers. For instance, complex post-traumatic stress disorder is often linked to ongoing emotional dysregulation. In survival situations, past trauma can cause the brain to react intensely to perceived threats, even when the situation may not warrant such a response. Learned patterns and environmental influences also matter. Emotional regulation skills are often learned through early life experiences. If someone grows up in an environment where emotions are ignored or punished, they may struggle to manage their feelings effectively under pressure. Without good role models for coping, it can be tough to develop healthy emotional responses. Cognitive and psychological factors can further complicate things. Negative thought patterns and difficulty accepting reality can lead to emotional dysregulation. When faced with stressful situations, the inability to pause and assess calmly can result in impulsive reactions. Lastly, a lack of distress tolerance and coping skills can make emotional regulation harder. Distress tolerance is the ability to endure emotional pain without resorting to harmful behaviors. If someone lacks these skills, intense emotions can feel overwhelming, leading to outbursts or avoidance. In survival contexts, this can hinder decision-making under pressure. So, what can we do about it? Learning practical survival skills can help. Techniques like distraction can manage overwhelming emotions temporarily, preventing impulsive actions during high-stress moments. One effective method is the stop skill. This involves stopping what you are doing, taking a breath, observing your thoughts and feelings calmly, and then proceeding thoughtfully. This technique creates a moment of pause that can prevent impulsive reactions and support better decision-making. Building distress tolerance through acceptance of reality and practicing coping methods can strengthen resilience. This is especially important in survival scenarios where emotional control impacts the ability to respond effectively to threats. Emotional dysregulation arises from a mix of biological, psychological, and environmental factors, often worsened by trauma and stress. By learning to manage emotions through specific techniques, we can maintain control and make sound decisions under pressure.